Okay, so welcome everyone for the first Rex Crossley Award for the term 21-2022. Basically, Rex Crossley Award is an award provided by IFMSA in recognition of the work and achievement of the best attractive activities from our NMOs. The awards of the activities to the one who have meaningful impact in their community. This award is named after Mr. Rex Crossley, one of the founder of the International Federation of Medical Student Association. And to be clear, the term activity used within IFMSA as an umbrella expression to unite any campaign, project, advocacy effort, article, conference, etc. that is organized by the NMO. So basically, how will the event go? We're gonna have 8 activities, which made the final the final list. 4 activities are going to be presenting at the beginning, and each of them will take 5 minutes and 3 minutes for a question for the judges. Then we're going to take a 10-minute break for everyone to refresh up, and then the other 4 activities, and we're going to have 5 minutes break where we're going to be having a program promotion, and 10 minutes at the end to closing remarks. So we had received 56 activities. They were selected and evaluated by at least 2 program coordinators and or a program team member, including the core team and the VPA. And then we selected the 8 highest activities in accord to taking into consideration regional representation and standing committee representation and program representation. So here you are the 8 finalists. The awards for the first place is going to be 150 euros, and the results are going to be announced soon during March meeting. So stay tuned for that. If you have any questions, feel free to ask. If not, we're going to move on to the judges to introduce themselves. So no questions so far. Before introducing the judges, I would like to thank them for their for giving up time from their busy schedules for being here. And we're starting with Amin. Amin, the mic is yours.
Thank you so much, Hassan. Hi, everyone. My name is Amin from Algeria, and I'm the current IFMSA president. Congratulations to you all for making it this far. It's always very, very exciting to see the activities that get selected every GA, and I really, really can't wait to see your presentations, and wishing you all the best with your activities and, of course, with the Rex Crossley Awards.
Thank you so much, Amin, for being here. Moving on to Tomasz.
Thank you very much, Hassan. Hello, everyone. My name is Thomas. I'm from Slovakia, and this term I'm representing IFMSA as the director of the Standing Committee on Medical Education. Just echoing the words that Amin said, congratulations on getting this far. I already reviewed your activities in our spreadsheet, and I'm more than excited to hear your presentations. So good luck with the presentations, and also good luck for the announcement during the March meeting.
Thank you so much, Thomas. Moving on to Claudia.
Hello, everyone. So I'm Claudia, the liaison officer for SRHR issues, including HIV and AIDS, if I'm stating my full longest name in IFMSA. So I'm very excited to hear all your activities, and it looks very amazing from the spreadsheet as well. So congratulations of making this far, and yeah, because it's an honor to be here already. So despite of how the things will turn, it's just amazing success that you have with your activities. So thank you for having me.
Thank you so much, Claudia. Moving on to Nuria.
Hello, can you hear me? So hello everyone.
Yes, loud and clear.
I'm Nuria and I'm SCOF Capacity Building Development Assistant. And I'm also really happy to be here with all of you and to see all the successes of your activities. So congratulations everyone for your incredible activities. I can't wait to see the presentations and best of luck to everyone.
And we have a fifth judge, Taide. She is having a connection issue. She'll be joining us in a minute. She is the IFMSA Program General Assistant, and I'm sure she will congratulate you for making it so far. So if there is no question, we're gonna start with the first activity. I'm gonna share my screen, and please let me know to move on the slide to next. So you can see my screen now.
Hussam, I think there's somebody in the participants part asking to be panelist. I don't know if it's one of the participants for the Rex.
Oh, okay, thank you so much. Okay, so whenever you're ready, I can start the timer.
Hi, the video isn't work, please.
You can hear us, right? And you can see the presentation.
The name of the activity is Break the Silence Campaign, and I'm Ibrahim Al-Jabri. I'm president of this campaign. The campaign is talking about child neglect. So what do we mean by child neglect? Next slide, please. According to UNICEF, it means a parent's inability to provide the required care for their child's growth, including health care, education, emotional support, despite the ability to do so, endangers the child's health and safety. Next slide. So neglect may be considered when there is family disintegration, mental problems of the parents. As a child, a parent was ignored. A large number of children in the family. Also, gut showing is a serious issue in our country. As we are living in a community where the health facilities are very poor and there is a lack of psychological education centers and the level of general knowledge is very low, all these factors contribute to make children more vulnerable to neglect. So we try to focus in our campaign to educate and raise people's knowledge and awareness about the child neglect, and to shine some light on the importance of this issue in children themselves and the community, as they are the building unit of it. So we started to design our campaign and set the objectives as the follows. Next slide, please. The first is to raise the awareness of child neglect among 300 parents in Hadramaut Governorate in Yemen on the World Child Day. The second is to raise the knowledge of the children's optimism, self-esteem, intelligence, creativity, and independence among 300 parents in Hadramaut. The third is to raise the awareness of child neglect among 1,000 people in Hadramaut through the social media platform during 5 days. Then we send the call for the organizing committee and discuss the campaign's appropriate timeline and work plan. After that, we separated into groups, each of which will work on different subjects. The campaign has two parts, the online awareness and the public awareness. Next slide, please. We began the campaign on the 15th of November 2021 with an online awareness that lasted for 5 days, ending on the 19th of November. Every day we post infographics like this that define the concept of child neglect, as well as the causes and types of child neglect and the effect on children. Next slide, please. We also post infographics about the solutions and remedies of child neglect, as well as the parental guidance and recommendations. Next slide. At the day 20 of November, we began the public awareness that it were in the public place in Al Mukalla city, the capital of Hadramaut, about 5 hours, explaining to people the effect of child neglect on children, as well as teaching them about the responsibility of society in putting solutions in place and correct to offer some light such as face printing. Next slide. So they had fun and enjoyed to that. The next, the evaluation. The evaluation of the campaign was assessed in 2 ways. First, by making a video asking people to attend the public awareness about the knowledge of child neglect before the awareness as a pre-awareness assessment, and then asking them after the awareness about the information they received and what they would do to educate their families and the community they live in as a post-awareness assessment. The second is by calculating people's interaction on various social media platforms concerning the topic of child neglect. This next slide. The campaign met all of the success markers by raising the awareness in our community about the notion of child neglect and the impact it has on children's life. The online awareness reaches a large number of people who are interested in this topic, including general public, doctors, social characters, academics, and others. The on-ground activity also resulted in wider spread of the importance of this issue locally, allowing for future solutions. Next slide. As we targeted more than 300 parents in our campaign, we aim that those will grow up with healthy mentality and provide the information to other people and contribute to change in our community. We're also planning to repeat the activity next year. In addition, as one of the steps toward achieving our vision in the future, we will expand our target group, including some specialists of child neglect issues, and planning to get more information for the wider view of the topic. Thank you.
Thank you so much, Brahim. Now moving on to the judges. Please make sure to write down the questions the judge is gonna ask, and then you have 3 minutes to answer their questions.
Okay.
Yes, Thomas.
Yes, thank you very much, Ibrahim, for the presentation. The activity looks very interesting, and congratulations on concluding it with a nice impact. I was wondering, when it comes to the impact and the sustainability, as you divided the activity into 2 parts, an online campaign and, let's say, in-person campaign, I was wondering, how did you spread the word to 300 parents in your community, as well as perhaps what activities did you conduct on ground to engage these parents?
I'm sorry, can you repeat your question?
Yes, I think that I can also type it into the chat. So my question was, how did you spread the word to the parents, as well as how did you engage them on ground?
Okay, did you get the question? Ibrahim, can you hear us? Okay, so whenever you're ready, you can start. Yes, Anian?
We decided to engage 300 parents because it is the first activity regarding this topic. So in the beginning, or at the first, we will see how it affects and how we will manage that. In the future, we will expand other parents in the activity.
Okay, thank you so much, Ibrahim. Moving on to Amin, your question.
Thank you so much, Ibrahim, for the presentation and congratulations on your activity. Before I ask, can you hear me? Or maybe I should type the question directly in the chat.
I'm sorry, I couldn't hear you.
It's okay. I will write the question directly in the chat. If that's better, I guess. I just typed the question in the chat, Ibrahim. I don't know if you're able to see it.
Okay, so Ibrahim, can you hear us now and see the chat? Okay, this is the last call for Ibrahim. If you can't hear us, we're moving on because we are running out of time with the agenda. Okay, it's unfortunate that Ibrahim can't hear us. So moving on to the second presentation, Touch of Life. Whenever you're ready.
Hello everyone, my name is Lana Podlesnik, and today it is with great honor that I can present to you our activity Touch of Life from Slovenian Medical Student International Committee. Next slide, please. We are all aware that cancer is one of the biggest healthcare problems worldwide. In Slovenia, many public health projects aim at early cancer detection, which enables early treatment and prevents advancement of the disease. Breast cancer is the most common form of cancer among women, but with regular self-examination, every woman can take steps towards early detection. And the same goes for testicular cancer, especially common in younger men. Next slide, please. We as medical students wanted to join the battle with cancer through our vision of empowering younger people with necessary knowledge about correct self-examination. Next slide, please. We do this mainly through workshops, which are mostly conducted in high school classes of about 30 students. And reaching people at younger age is an advantage as they can incorporate what they learn faster. And we also believe that knowledge transfer is more effective in smaller groups, especially considering the workshops are partly interactive in nature. Our typical workshop consists of a theoretical introduction with PowerPoint presentation and video material, followed by a practical approach where students can learn self-examination on our anatomical breast and test these models with applied pathologies. And at the end of the workshop, we always dedicate some time for questions from the audience as well. Next slide, please. As you can see on the graph, our primary target population is between 15 and 22 years. Next slide, please. After the workshop, we conduct an evaluation which is accessible to students via QR code. And this way we can collect useful data regarding the quality of the workshop, as well as a comparison of knowledge before and after our presentation. This enables us to consistently upgrade our activities so that students can have the greatest possible takeaway. Just in 2021, we have conducted 25 workshops, reaching a total of more than 700 people. Over 80% of participants found the workshop interesting and educational, as well as thought they acquired new and useful knowledge. As you can see from the graphs, just shy of 90% of participants stated they never examined themselves at all. So we're very glad to see that most of them were encouraged to try and start to self-examine themselves after the workshops, which is one of our main goals. Next slide, please. Every year, we also aspire to diversify our activities. So in addition to the workshops, we aim to organize bigger events for a wider array of audiences. In 2021, we organized many such events, one being online in form of a conversation with a testicular cancer survivor. This deepened our understanding of the experience cancer survivors go through and strengthened our belief in the importance of our work. The recording of our conversation was later uploaded on Facebook and was viewed over 1,200 times. Next slide, please. The second event was a symposium on breast cancer named Life Through Rose-Colored Glasses. There we listened to 3 speakers, one being an author of a book and breast cancer survivor, the second being a plastic surgeon, and third being a tattoo artist specialized in tattooing areolas after mastectomies. Next slide, please. An important part of our work is also maintaining a social media presence, especially considering it is such a big part of our lives nowadays. Our social media team strives to post weekly educative and evidence-based facts, as well as monthly reminders, quizzes, and giveaways. We also organize a yearly Instagram campaign where we invite Slovenian influencers to participate under the hashtag Encourage the Touch. Next slide, please. In our work, partnership is the key, so we try and collaborate with other organizations with similar goals, such as Slovenian National Screening Program for Breast Cancer, DORA, Europa Dona Slovenia, the Oncomen Society, and many others. Together, we are working towards giving our part in educating our nation, as well as reaching some of the sustainable development goals, such as good health and well-being, quality education, and gender equality. We also try to maintain internal sustainability with consistently bringing on new team members. We can proudly say that we do that efficiently, as Touch of Life just surpassed its 10th anniversary. Next slide, please. The team is currently working on another year full of activities, such as member gatherings, public stands, educational workshops for our lecturers, roundtable discussion with breast cancer survivors, as well as at least 30 of the aforementioned workshops for students, to just name a few. The goal of our activity was, is, and will continue to be encouragement of as many women and men as possible to educate themselves in this subject and do regular monthly self-examinations, while also working to grow as medical students, educators, and a society as a whole. Next slide, please. Thank you all for your attention.
Thank you so much. That was perfectly on time. Moving on to the judges. Okay, starting with Amin, Thomas, and then Claudia.
First of all, thank you so much for the presentation and congratulations on your activity. So my question would be if you can just elaborate a little bit on the role of your partners in your activity. Thank you so much.
Do I answer right now or after the questions?
No, after the judges finish their questions. Okay, so Thomas and Claudia.
Thank you very much, Lana. It's a very nice activity, and we actually have a very similar one in Slovakia, and I participated as a trainer in one of those events. So it's a nice memory. I was wondering if you could tell us more about the evaluation of the knowledge, skills, and attitudes of the participants. Since you have mentioned that you have done a post-evaluation, I was wondering, have you also done like pre-evaluation, or you only focused on raising their knowledge, skills, or attitudes in the post-evaluation? I also typed the question into the chat. Thank you very much.
Thank you, Thomas. Now, Claudia.
Yeah, thank you, Lana, for your presentation. The numbers are really impressive for how you reached that many people with your activity. My question is about the target group, because the activity is about cancer prevention, and from your presentation, I understood that you target younger people, but I wanted to ask, have you planned to diversify the group and also include older populations in your activity? Thank you.
Thank you so much, Claudia. Did you get the question? Whenever you're ready, feel free to start.
Okay, so thank you for all for your questions. The first question was about our partners. So we collaborate with many different organizations. For example, DORA, so the National Screening Program for Breast Cancer in Slovenia. We, as members of the Touch of Life, attend their courses. We also promote each other on social medias, and we promote their screening program, which is very important for raising awareness in Slovenia. For example, with Association of Slovenian Cancer Society, we were partners, and they provide us leaflets to use on our public stands. With Oncoman, we attend their events, for example, because Oncoman is an association for oncology for men in Slovenia. So as we promote self-examination of men as well, we attend their events and promote them on social media as well. We then have different partners for example, financial donations, so we can continue with our work. So the next question was about evaluation process. We have a survey after the workshop, and the participants fill out the form. Yes, we only have post-evaluation questionnaire because our primary target group are secondary school students, and their school lessons only last for 45 minutes. So our time in school is very limited, and we decided to only do the post-evaluation process because we want to also have time for our lecture, of course. In our post-evaluation questionnaire, we collect data of like gender, age composition, about how interesting the participants found our lecture, then about new and useful knowledge, as well as how educational the workshop was. We also ask about if participants did the self-examination before our workshop, and then compare the results to whether they will try to self-examine after, which is very important data, I think. So the last question was about primary target group. Yes, our primary target group are high school students, so the age 16 to 19 or 15 to 20, 22. But with all our activities, we also aim to reach general population. Like bigger events are for general populations, and we also organize workshops not only for schools but also for associations, companies, for their employees. So we target like a group from 20 to 60 years as well. But why we decided our primary target group are younger people, because testicular cancer is the most common in younger men, so between 18 and 35 years old. And because breast cancer, yes, it is most common for women after the 50 years old, but our screening program is only for women after 50 years old. So we also wanted to provide like knowledge to younger women, that they start as early as in high school, because this is crucial for early detection and better prognosis afterwards.
That was perfect on time. Thank you. Thank you so much.
Thank you.
Moving on to the next presentation. Whenever you're ready.
Okay. Hello, everyone. My name is Tiati from IFMSA Thailand. Today, I will present you about community resident in COVID-19 pandemic project. Next slide, please. Over the past few years, the COVID-19 has become a global crisis. It's not affecting only people's health, but also many other aspects, especially community infrastructure. According to the survey sample in Munai Community Thailand, we interviewed and discovered that people are overly cautious and aware of COVID-19. They were terrified to contact each other. So we need an idea that can comprehensively and sustainably develop communities. Building community resilience is one such idea since it can strengthen the community in all 9 related aspects. There are few implementation around the world such as Singapore, Shanghai, China, and Nakhon Sawan province, Thailand. Next slide, please. To complete this project, we have 3 objectives we try to achieve. First is to identify the status of vulnerability in the communities. The second is to identify a minimum of the potential element in the communities. And the third one is to design and implement an intervention model that is capable to improve the communities. Next slide, please. And here is our indicator of success. We have 4 indicators. The first one is we identify at least 3 of the most significant vulnerability of the communities. The second one is we can identify the cause of the 3 most significant vulnerabilities. And the third one is we can see the noticeable improvement due to the PDCA methodology. And the fourth one is at least 100 community members state to have seen at least 10% improvement in the potential elements. And for the evaluation process, we use CRP toolkit, a pre-post evaluation questionnaire, which were reviewed by our advisor, and using IOCE index for its validity and use callback alpha coefficient for its reliability. Next slide, please. And here is our timeline. Next slide, please. After all the preparation, we start to explore the status of resilience in the target community, and we found that in the health, the communication, and the mental outlook element are lowest among the 9 elements, and these 3 elements are related with the keyword we found from the interview with the community members, and these 2 data lead us to the design project in the next phase. Next slide, please. In the project design, along with the community members, we decided to do 5 activities to attack the community problems. For the example, the group chat community that aim to increase community channel variance is aim to attack the communication problems in the communities. And there are also the 4 more of it. The next slide, please. And here is our picture during the 5 activities. Next slide, please. And after all the hard work, here is the result. Quantitatively, the health element increased around 22% compared to the pre-project evaluation. The mental outlook element increased around 12% compared to the pre-project, and same as communication that increased around 5%. This means that 2 out of 3 elements that we are focused on are increased more than 10%. And for the qualitative approach, negative keywords are down to 0, and we have 4 more positive keywords come up in the post-project evaluation. Next slide, please. So after the result and the activity we done so far, we have increased the easier way to access the healthcare service, the create better understanding of knowledge of COVID-19, and increase variance in communication channels, and induce more support service in the communities. This will lead community to have a self-management skill. In individual scale, the community members will have more resilience to attack the problem in the future, even the pandemic ends. And in the overall community, members are decreased in fear, increasing in community health service using to reduce the overload of the government and be more united, and at last be more communicate. Next slide, please. Thank you for the for the attention.
Okay, thank you so much for your amazing presentation. Starting with Thomas and then Nuria.
Thank you very much for the presentation and congratulations on the work. My question is related to one of the goals of your activity, where you mentioned implementation of an intervention model. So in your own words, how established was this model and what impact did it have on your community? I also typed the question in the chat.
Okay, thank you so much, Thomas. Nuria?
Thank you very much. My question would be if there was any specific criteria that you followed to select this specific community in which you conducted your activity, and if you were planning to expand it in the future to other neighborhoods or other districts.
Thank you so much, Nuria. You have 3 minutes to answer. You can start whenever you want.
Thank you for your all the questions. For the first answer, the implementation and how we establish it. So we talk with the community volunteers. So what would they like, and we start to talk together to make the cooperation, make the implementation suit with the communities. And the impact is we saw that in the 5 activity we come up with the members. We have that community are increasing knowledge. Yeah. And they are in the in-depth interview we have saw that they use a more light tone in the voice that cannot be described in the presentation, but in a qualitative it has, and they are we can see the more of a positive keyword in the results, and moreover we have seen that actual change in the community, such as we take a photo of the community that in the health community volunteer they have a PPE suit, and or moreover they have a more mass and more supply, and there were no complaint about lacking supply in the community member in the quarantine. So they it helped them improve quality of life to sustain the law in the pandemic. So in the second question, the specific criteria for target community and future neighborhood. So I would like to answer the second question. Is future neighborhood in process to make in the nearby community, we have to establish the cooperation first. We have to find get communicators to make us let us through to the project to the community, because some community doesn't allow the outsider to work with them. So we have to do in our part to collect the data and talk with them, and them have to cooperate with us too. If two of this work, the impact can be also like this target community, or maybe a bigger project with the help with the partner, such as the government or the investor of the communities. And for the specific criteria, that we take a consult with the advisor to see that which community has a most vulnerability in the lack of time we have is 5 months. So to be specific, this is a most vulnerability around in the nearby area we have to work with. Yes, this concludes all my answers.
Thank you so much for the presentation and your answers. Moving on to the final presentation for the part 1 of Rex Crossley Award before the break. Whenever you're ready, you can start.
Hello, everyone. I'm Yusra Malik, and the title of our activity was the Medical Student Forum for Sexual and Reproductive Health and Rights. Next slide, please. So basically, SCORE committee throughout Medicine Sudan has been working in collaboration with the WHO, advocating against FGM and its medicalization. Anti-FGM campaigns were held, safe motherhood trainings, and like other trainings. In continuity, and after like the FGM laws were established in Sudan, and after the country priorities were changed, comes this forum. Next slide, please. Okay. So this event focuses or like the country's main 4 priorities were FGM, gender-based violence, child marriage, and family planning. The event focused on the root causes and gaps, as well as ways and means to address them, and re-energized the commitment of all participants to combat gender inequality and scale up prevention and response to the most types of gender-based violence in Sudan. Next slide, please. So the forum included medical students from all different levels of experience, and it encouraged experience sharing between the different participants. Our targeted groups were Medicine Sudan members, 13 LMOs were involved, and other various local organizations addressing gender-based violence and SRHR topics. Next slide, please. Okay. As I mentioned before, we had 7 main goals that were discussed over 3 days. So the activity was took place on the 10th, 11th, and 12th of July at Grand Holiday Villa Hotel in Khartoum. So day 1, we spoke about the most important topics were the SRHR country priorities, gender-based violence and sexual violence. The major concepts that were covered were the differences between gender and sex, the types of gender-based violence and sexual violence, and the WHO protocols and guidelines in gender-based violence situations. Next slide, please. Okay, these are the 3 goals that were discussed on day 1. Goal 1 is to increase the awareness among medical students about the recent country priorities in regards to the sexual and reproductive health and rights. Goal 2 is to empower the participants to implement programs to eliminate gender-based violence and advocate for gender equality in a culturally sensitive way, putting into application the learned tools and methodologies. And goal 3 was to increase the participants' awareness about the role of healthcare providers in responding to gender-based violence, especially sexual violence, and equipping them with the needed knowledge to provide clinical care and support the gender-based violence survivors. Next slide, please. Okay, the second day was facilitated by the same facilitators that facilitated day 1, which is Dr. Maysoon, who is WHO representative, and Arij, who was the Africa RA for 2019-2020. But it tackled different topics such as FGM, child marriage, and family planning. These were like explored in depth, and light was shed on the national situation and laws of each one. Next slide, please. These are the goals for the second day. Goal 1 is to increase the awareness among medical students about FGM and the legal situation in Sudan. The second goal was to increase awareness about factors behind child marriage, its effects, and the legal situation in Sudan. And the third goal was to increase awareness about family planning and contraception services. Next slide, please. Okay, the last day of the forum was under the theme of experience sharing, as the variety of the enthusiasts and experts with different backgrounds were reflected on in their experiences in regarding SRHR, particularly in rural areas and in contact with the community. Next slide, please. Okay. Day 3 also discussed the plan with the WHO, including the forum's follow-up plans, which were the social norms change training in collaboration with the Ministry of Health, followed by community outreach to all of Sudan, but it was stopped due to the political situation in Sudan, and it will be continuing on March of 2020. Next slide, please.
Unfortunately, time's up. Thank you so much for your presentation. And moving on to the judges.
Okay. You're welcome.
Starting with Claudia, Amin.
Thank you, Sudan, for your presentation. I'm very happy that you responded to the new law situation in Sudan, and congratulations on this law. And also, I'm very happy to see my fellow SCORA array involved in this project. But my question is regarding sustainability of this project, because this was a one-time activity, I assume. But how do you want to go forward? Do you want to expand the impact of this activity? Like, what are your future plans?
Okay, thank you so much, Claudia. Moving on to Amin.
First of all, congratulations on your activity. I heard a lot about the work on FGM in Sudan from a lot of friends. So it's always happy to like see these activities. So congratulations and thank you for the presentation. So I actually wanted to ask first the same question as Claudia. And I also wanted to ask you about um, including like the sustainability, about particularly about the training that you're planning to do with the ministry. If you can give us like a little bit, you know, more details about that. And thank you so much.
Thank you, Amin. Whenever you're ready.
Okay, so in regards to the sustainability, the forum was targeting medical students who are like the future healthcare providers. And we like, I'm sorry, I'm getting nervous. So we gave them all the knowledge and all the tools for them to be able to go out and advocate. And some of the follow-up for the forum, follow-up activities for the forum is the social norm change training and community outreach. And one of our achievements was that some of the medical students that actually attended the forum went back to their states. They were from all over Sudan. They went back to their states. And this one in particular, they were from the Red Sea state, where these topics are a huge taboo. And they were actually able to take the knowledge and the tools that we gave them and implement that over there, which is a huge success for us. And so in our sustainability, we're mainly focusing on community outreach and the trainings that are going to be carried on from March and forward, moving forward.
So thank you so much for your
thank you for
answers.
your time.
Okay, now we have concluded 4 presentations. Now we're gonna take a 10 minutes break, actually the break for the judges, and everyone, you can enjoy the program promotion content that the amazing program team have prepared. So the program team, the floor is yours.
Thank you so much. Okay, Husam, can you confirm that my my slides are visible?
Yes.
Great. Well, hello everyone. I hope you're having a good time with all these amazing activities. We're very, very excited to meet you at this first Rex Crossley Awards for these years. And well, today we're here to talk about a little bit more of the spot that the IFMSA programs have for your ideas and your projects. First of all, let's remember that every IFMSA program is an authorized body to affiliate your activities, and we want to offer you as a coordinating team and international platforms for all of these projects. We want you to create new activities, to meet new people who's working in the same working lines as you, and so this project can go to a higher level, not only for your team, but also for your NMO. To talk a little bit more about how this can happen, I have an amazing partner today. She's Miss Antara, our program coordinator for HIV and other STIs.
Hi, everyone. First of all, I'd like to congratulate for all your activities. These are so amazing, and I'm hoping to see the more amazing activities after this short break. Now I'm going to talk about why is it important to enroll. And there are so many ways, and without enrollment, your activities is not approved in this Rex Crossley Awards. So you should know why it is important. First of all, you get support from the program coordinator in various systems like continuous development and design of the activity. You can evaluate and monitoring of the activity, seeing the activity's impact in the program annual impact report, which is very important as a PC. So you must enroll if you want to see your activity promotion in activity annual impact report. Then on the other hand, providing relevant resources, including but not limited to documents, toolkits, regulation, then overarching contact with the relevant IFMSA officials and NMOs working on similar topics. Next slide, please. The second one, you can get the eligibility for different IFMSA opportunities. How? Application for the activities where in General Assembly meetings and or regional meetings that it's going to be happen very soon in March meeting as well and August meeting as well. Application for the Rex Crossley Awards, you can already see that. Application for grants and scholarships such as MEMO program grant, etc. And last but not the least, international recognition. The activity is officially affiliated with the endorsed by IFMSA. You can get the IFMSA certificate as well. How? That can possibly help you to receive support from the local, national, and international authorities through IFMSA recognition that can support you to find external partners for support, collaboration, partnership, resources, including fundraising as well. Next slide, please. Usage of the IFMSA logo. You can add your the posters that you made for the promotion of your activity in your NMO. You can add not only your NMO logo or the external partner logo, you can use the IFMSA logo and can get the IFMSA recognition as well. Inclusion in the IFMSA activities database, which is very important for your activity. It can build a community of healthcare students occupied with knowledge and skills on specific topics and activities. It can collaborate with other NMOs and activity coordinators that work in a similar area of interest and improve the impact of the activity by learning from the other activities or by joining forces with other NMOs as well. And last but not the least, the impact of the activity is coalesced with the program annual impact report that increases the visibility of the NMO. Thank you so much.
Thank you so much, Antera. Well, as you can see, enrolling an activity goes way further than, you know, just sending an activity and eventually reporting. This is a series of benefits for your project, for your team, and also for your NMO. And we would be really, really excited to meet all of the activities and projects that you are creating. So if you have any question, if you would be interested in enrolling those activities, please send a message to our amazing program coordinators and the whole programs team. We're here to help you. And that would be all. We'll go back to you, Hussam, and we'll see you in a bit more.
Okay, so we have kind of 5 minutes left in the break. So feel free to drink water, take a snack while the judges rejoining. So, and the judges, please let me know whenever you join. Okay, perfect. So we'll come back, everyone, to the first Rex Crossley Award for this term. For the second part, we have 4 activities left. And here is the presentation. Whenever you're ready, you have 5 minutes and 3 minutes for questions.
Can you give me 1 second, please?
Excuse me? Can you repeat what you said?
Just give me 1 minute, please.
Okay. Whenever you're ready.
Yes, I am ready. Thank you so much for giving me this opportunity. I would like to start with a quote There is a stranger in a photograph that he can't recognize. She has a dress on and long hair, sadness in her eyes. They colored him pink, wiped him off red, but on inside he was blue and the pink filled him with red. We, Skora BMS's Bangladesh, proudly present our beautiful activity, Kinor Kahon, presented by me, Noshit Abasim Kabir, and Tasmima Islam Aishi. Please turn on the slide. Next slide, please. Our category of activity was campaign, and it was focused on LGBTQ issues and organized by Skora BMS's Bangladesh. And it was our first ever event done by Skora BMS's Bangladesh in collaboration with Bondhu Social Welfare Society in a remembrance of Transgender Day and Transgender Awareness Week. Next slide, please. Our problem statement was very clear. It is estimated that around 1 lakh transgender people working in sex industry, and since it's a very sensitive topic, a lot of people are not focusing or not accepting transgender people, calling them they are not part of us. As a result, they are forced to be part of this sex trade and working as many inhuman trades and many inhuman activities that they're getting deprived of every rights. And there's an increased rates of HIV, STDs, and lower likelihood of preventive cancer. And they're getting lack access of quality care. Next slide, please. Our target group was very clear: medical students, school students, health professionals, teachers and staff, transgender people, and trans rights activists. Next slide. Our goal is to organize an awareness campaign on the transgender issues. An objective was to organize a webinar with trans representatives and organize a day-long awareness campaign at a school, engaging school students to talk about this transgender issue, to organize a health camp giving this transgender community free treatment, creating a revival connection with this community and engaging more medical students in this, and organizing a radio show as well and spreading awareness via social media. Next slide, please. Our success indicator was 10 transgender person who will be in this health camp and get the free treatment. 20 medical students participating in the health camp will have a clear concept on this. 30 school students participating a day-long awareness campaign where we took a session on gender, sex, sexuality, and transgender. 1,000 people will be watching our webinar, and 75% participants will address this issue, and 70% of the participants will have a clear idea on this. Next slide, please. Our methodology was social media campaign, interactive session, on-field awareness campaign, photographic record, radio show, questionnaires, participant observation, health camp. Next slide. Schedule was very clear. That was started from 5th November to 8th November 2021. And we started from 5th November by a meeting with our external partner. Then we conducted a webinar on 15th November. Then we had an awareness session at SOS Herman Maynard's College. And we had a health camp on 26th November and radio show on 28th November. Next slide, please. You can already see the implementation. We conducted a session at a school. We conducted health camp. We conducted webinar. We conducted as well as a radio show. So where we have talked about sex, gender issues and transgender issues, a lot of people don't know and mix transgender people with other terms. We had taught them on this topic, and we have talked about their sexual and reproductive rights. We have talked about the stigmas around them. We have talked about how STDs, how HIV/AIDS are more prevalent in them. We have also conducted SWG, where we had students and transgender among with them. They have discussed about how healthcare system can be very much easy, accessible for them. Next slide, please. Evaluation, we had pre and post evaluation form, specific indicator, group discussion, teaching method, interaction between students and transgender. Next slide, please. You can already see the impact. We have given free treatment to 20 transgender people. 50 students were enlightened on this session. 1,200 people watched our webinar and 1,400 people watched the radio live. And 30 medical students attended the SWG. Next slide, please.
Time is up. Thank you so much for your presentation. Now moving on to the judges. Okay, we have Nuria.
Thank you very much. So I wanted to ask with regards to the health camp, you mentioned in your activity description that one of the goals was that 20 transgender people would receive healthcare attention. I wanted to ask you if you could elaborate on the goal of the camp related to the medical student that attended it. What was the desired outcome regarding the medical student, and how did you follow up on this goal, if you did it?
Can you please write down in the chat box, please?
Yes.
Thank you so much. We had a health camp over there, and we have invited 30 medical students. In that, not only we conducted a health camp where the 20 transgender people were given free treatment, but also we have conducted an SWG. We have taken a session on sex, gender, and sexualities and transgender. Who are they, and what are their priorities? What are they getting deprived of? So we also did a pre-evaluation form where we have assessed their knowledge. We have already talked about it, how much they know about it and what are the changes they want to make. So we had a pre-evaluation form, and in the post-evaluation form, we have already assessed their knowledge, what they gained through this medical camp, by talking to them face to face, by visualizing what they are saying, by hearing their story in person. They have a look, this whole idea how they are suffering in our Asian countries. And we have also conducted SWG where they have traded their ideas. They were in the same group where a transgender talked with 4 medical students, and they were given specific scenarios that they would face on a daily basis. So this is how they actually gain the knowledge via health camp, by knowing their problems, what they face on a regular basis, how much accessibility they get in healthcare system of our country.
Okay, thank you. Thank you so much for your presentation and answers. Moving on to the 6th presentation. Whenever you're ready, the mic is yours.
Okay, hello everyone. I am Saif Ali, IFMSA Egypt representative, and also I'm Mental Health National Coordinator. So now we are presenting our mental health activity for the past year. Next slide, please. So our table of content, we are starting with the problem statement, goals and objectives, success indicators, monitoring, evaluation, outcomes, and sustainability. Next slide, please. Next slide. So starting with the problem statement, I couldn't find a better way to describe the problem statement. So during COVID, we all know that COVID didn't only impact our physical health, it also affected our mental health, and because of the pandemic and the shifting from the physical to online and all of that. So according to research has been published on NCPI, so an anxiety prevalence has been increased from 6% to 50% 40%, and PTSD from 7% to 53%. This is worldwide. Next slide, please. So respectively on Egypt, next slide. So in Egypt, stress in work has been increased to 34%, and in home to like 63, as I recall. And in medical students, we all noticed the increase of stress and burnout because of the shifting from attending physically to the online courses and so on. So getting to the goals and objectives. Next slide, please. So we have our goal is to contribute to promote mental health status on different aspects to decrease the prevalence of misconceptions about mental health and the mental disorders. And this is like a summary of the objectives. The first objective is capacity building of mental health trainers. And the second one is capacity building also, but on mental health and psychosocial support. The objective 3 is that we're increased awareness about 1,500 medical students and paramedical students. Next slide. Fourth objective is the increased awareness in public for 50,000 of the public and about mental health. And the fifth objective is to provide the trainers manual and resources to provide knowledge and trainers. Also, the sixth is contribution of mental health and different aspects. Next slide, please. And seventh and eighth is to activate and advocate for stakeholders to activate mental health units. Next slide. And we can see the objectives and smart way. Next slide. Next slide. Next. So success indicators, each one has success indicators. So like the first and second one is the graduation, and 70% of the people attended has increased the knowledge. Next slide. Next slide. And local workshops, we are okay. So the physical campaigns, at least 15 physical campaigns being reached, and 100 reach each, and online campaigns, at least 20 online campaigns reach of 3K, and small working group allocation of 10 motivated members. Next slide. Next slide. Let's get to the outcomes. Let's get to outcomes. Okay, so basically, monitoring and evaluation, we used monitoring. We used to seeking the methods of verification of each campaign has been done locally, and following up with the graduates of the graduates of the training we have been done, and so on. So let's get to the outcome. And the evaluation, we use the pre and post assessment, also seek method of verification. So the outcome is that we have a total of 25 certified mental health trainers, and next slide, 35 mental health and psychosocial support trainers. Next. This is like a method of verification pictures, and so we have like next one, next. We have like 27 physical campaigns have been reached, and we have reached like 6,000 medical and paramedical students, and we have like good training packages, and from WHO, our partner, and a total of 100 local workshops have been conducted with 500 participants. Next slide. We have like total 156 local posts has been reached, and we have reached like 300,000 of the public. Next slide. Next slide.
Thank you so much. Thank you so much for your presentation. Moving on to the judges. The mic is yours. Okay, so starting with Nuria, Thomas, then Amin.
Thank you. I wanted to ask, you mentioned that the newly certified trainers that you got from the workshop that you conducted would be capable to raise awareness and train about mental health issues. So I wanted to ask, which was the exact content with regards to mental health that this workshop included? And also if the trainers of the workshop had to follow any special criteria in terms of mental health knowledge, such as PFA certification or similar, in order to deliver the training.
Thank you, Nuria. Moving on to Thomas.
Thank you very much for the presentation. My question is related to one of the goals which you mentioned during your presentation, where you mentioned implementation of mental health units in universities and advocacy related to this. Could you elaborate a bit on this topic, since I think that you wanted to mention it in the outcomes, but you didn't get a chance?
Okay, so do you want to answer now or take any questions and answer?
Can I answer now or just, still has a question?
Yes, as you like. Do you want to take any question or answer now?
Yeah.
Also, you have 3 minutes regardless. Okay, the mic is yours.
First of all, congratulations on your presentation and your activity, and thank you for your efforts. So you mentioned also in your presentation in the objectives that you would like to raise awareness for 15,000 people within the general population, if I remember correctly, which is in line with this deconstruction of all the misconceptions about mental health. So my question would be, like, how would you evaluate that objective? Were you able to reach it? Because I saw at the end that you mentioned an online campaign, but were there any sort of extra evaluation to actually see the level of awareness and not necessarily just the outreach of the campaign? And thank you so much again.
Okay, thank you. And as you can guys see, I just missed the evaluation part for this one. I just didn't get the right time. So getting to Nuria, question about the criteria and the topics of the mental health training. So the topics were like about misconceptions and psychological first aid and stuff like this. It was mentioned in the first objective. And about the criteria of the trainers, for these trainers, we used like externals from our universities, like psychiatrists, therapists, and so on. And we also had like a previous batches which has online courses for mental health and psychosocial support and so on. And also for the mental health and psychosocial support, we have conducted this workshop with a partnership with the WHO, and we had the trainers from WHO, and they have got our knowledge. I hope that I got this question right. And regarding the second question about the mental health units, so the mental health units, we have our objective is like at least we have activated 2 mental health units in 2 different universities. So in the mental health units, we are using the use of the partnership between us and the WHO, and they are like connecting the units and the universities, the authorities, and so on to activate the mental health units. And we have like activated 2 mental health units, one in Mast University and second one in Ain Shams University. And it's working at the moment for medical student and paramedical student and so on. And for the third question, the evaluation and the evaluation criteria for the outcome for the public awareness, we have using the flyers used from the partnership with WHO, and the number of flyers we have given to the public in the physical campaigns, it indicate the number of people we have reached. And also the outreach of each physical campaign is done through and a monthly evaluation and a special evaluation report from each local committee to the national one, and through the online campaigns, through the interaction of people on the online posts and the outreach of the online posts, as you can see. So we have mostly reached about 350,000 of the public, which is way more of our objective. And I guess that's it for the questions.
Thank you so much for answering the questions. And moving on to the 7th presentation. So whenever you're ready, the mic is yours.
Hi, is my voice clear? Okay, I'm starting. Hi everyone, I'm Hande and I'm the Project Support Division Director in my NMO. Today we are going to be talking about our health literacy project. Next one, please. First of all, we need to answer the most important question of our project. What is health literacy? Next slide, please. Actually, health literacy is a consciousness that every doctor should have and convey to their patients. And the results of the research show that 7 people out of 10 people in Turkey have insufficient health literacy. And having insufficient health literacy causes not knowing how to apply to treatment, not understanding the basic medical terms, and also not even knowing how to apply to the doctor when they need. Next slide, please. The goals of our projects are, there are 5 main goals. The first one is to reach all of our local communities and to make every volunteer at Turkmenis realize the importance of health literacy in a short time. Second goal is to enable our local communities to organize activities within the scope of health literacy and its subtopics in a semester. And goal 3 is to increase the knowledge and awareness levels of our target audience by organizing at least one event in most of our local communities in general. Fourth one is organizing advocacy activities on social media and hosting awareness campaigns. And the last one is reaching our volunteers through social media campaigns. Next slide, please. These are our success indicators. I want to give you one of them as an example. Our fourth goal success indicator is to have at least 2 advocacy activities and social media campaign every term. We can move on to next one. Now I am going to be talking about the methodology of our project, partners and target groups. Next slide, please. Our methodology is actually organizing activities such as debating on topics where there is a formal discussion about social and health issues, to communicate with various NMOs to promote our projects outside of Turkmenis, to share information about health literacy within other organizations. The development of health literacy requires knowledge. So the first step of the project integration will be to organize an informational meeting on this subject and carrying out various social media activities and social media campaigns to increase awareness of health literacy and to reach out to our target groups more easily. And last one is to organizing a webinar and or a workshop on health literacy and its subtopics with the participation of external participants. Next slide, please. Our target group is medical students, and our beneficiaries are everyone with whom our target group communicates. And our working areas are rare genetic diseases, vaccine indecision, and antimicrobial resistance. Next one, please. These are some of our partners. I'm not going to be reading them. We can move on to next one. Thank you for listening to my presentation. And I would like to tell you that our project is also closely related to Sustainable Development Goals 3, 4, and 10. That's all. Thank you for listening to my presentation.
Thank you so much. Perfect on time. Moving on to the judges. The mic is yours. Judges, do you have any question? Yes, Thomas.
Yes, thank you very much for the presentation, Hande. It's a very nice project, and health literacy is actually like one of the topics which is also relevant to healthcare education or medical education. So my question would be, did you perhaps consider focusing in the project on advocacy in healthcare education, let's say implementation of health literacy courses within the medical curricula.
Can I answer the question?
Yes.
Okay. We actually work for this subject with this SCOMI team in our NMO. So I would like to answer happily. Yes, we are trying to do that and have all of the medical students learn about health literacy.
Okay, thank you so much for your answer. Judges, do you have any further questions? Perfect. Thank you so much for your presentation. Moving on to our last activity. Whenever you're ready, the mic is yours.
Hello, everyone. Can you hear me?
Yes, loud and clear.
Okay, perfect. Well, hello, everyone. My name is Brian Perez, and today I'm going to present La Batida Online, an activity with the Standing Committee on Public Health at IFMSA Panama. Next slide, please. Okay, first of all, I want to introduce you what is La Batida Online. Well, La Batida Online is a version adapted to the virtuality of our flagship activity at IFMSA Panama known as La Batida. It consists of a 4-week campaign where the participants will test their motivation in order to achieve healthy lifestyles such as exercising, consuming healthy food, and so on. Next slide, please. Now, first of all, I want you to introduce also why we did this activity and why in a virtual modality. Well, the World Health Organization reports that physical activity worldwide is declining. Also, here in Panama, 62% of Panamanian adults are overweight and more than 1 in 4 suffer from obesity. And the main reason why we did this activity in a virtual modality was the fact of the COVID-19 pandemic. As we know, during 2020 and 2001, this global pandemic affected most of our activities, limiting outdoor activities. So all this prompted us to adapt our main activity here in SCOF Panama to a virtual modality so we can promote healthy lifestyles even while at home. Next slide, please. Okay, what were our objectives? The first one was to encourage literary students from the health area to participate in the campaign. Also to reduce the number of hours in sedentary lifestyles, to increase the consumption of healthy food, and to deliver sessions with specialists such as coaches, nutritionists, and psychologists. Next slide, please. Now, how was the activity designed? Okay, La Batida Online consists of a 4-week competition where the participants had a series of rules in order to gain and add some points. If, for example, the participant upload their 3 daily meals and their daily routines, they will obtain a specific amount of points. If, for example, the participants carry out the challenges that we had, they will gain some extra point. And mainly if the participant promoted their progress to Instagram stories, tagging @SCOFPanama, they will gain some extra points. At the end of the month, we will have some, winners of the activity. Next slide, please. Okay, how was the methodology? The methodology was based on 4 main aspects: the policemen, the participants, the social media campaign, and the online session. I will explain this more with the evaluation. Next slide, please. Okay, the evaluation. The first thing that we need to answer, what was the role of the policemen? The policemen were members that their first main role was to monitor the participants and register the points. The evaluation here was based on the points registration. We expected 40% of the data of the participants to be registered in a database. At the end of the month, we have 95% of the database was registered, something very impressive and excellent. Next slide, please. Also, in the participants, which were the competitors that were gaining the points to win at the end of the month, we expected in the registration 30 participants. At the end of the registration, the reality was that we had 80 participants, very impressive too. And also, if the participants were doing the activities, we have the completion attendance form where they were uploading their photos of their progress. And at the end of the month, we have that 52 of the participants responded correctly this form, and they were accomplishing their healthy lifestyles too. Next slide, please. Also, as I mentioned, this was mainly a social media campaign. We had like 16 publications and around 10 stories with the challenge. And we evaluated this through the amount of likes, the amount of comments, and in total, we reached more than 300 likes and 100 comments. Very interactive among the followers and the general population too. Next slide, please. And finally, we have the online session with a psychologist, the trainer, and the nutritionist. They were evaluated with a Google form, and they were accomplished the indicators of success too. Next slide, please. Okay, here you can see like a video, which was the activity impact, which mainly was based on the promotion of the activity. A fun fact is that I met the activity and the standing committee on public health by this activity. It was very interactive. The participants were uploading Instagram stories with their progress and was very amazing. Next slide, please. Next. Okay, and importance. Why this activity is important? Because there's no distant barriers. It tackles NCDs and promote healthy lifestyles. It's sustainable during the pandemic and it's resilience.
Time is up. Thank you. Thank you so much for your presentation. Moving on to the judges. The mic is yours. Okay, starting with Claudia.
Thank you for your presentation. So my question is pretty similar to the other I asked to people. So this activity is online, but then what are your plans to move forward to physical settings or like after COVID? So just like knowing your future plans. Yeah, that's for me.
Thank you, Claudia. Moving on to Amin, then Nuria.
Claudia is asking one of the things that were on my mind for the second time. But I also had another question because I also understood that you wanted to raise awareness through a competition, which is a really, really creative way to do so. But I'm not sure if the numbers were mentioned somewhere. If you could maybe tell us a little bit more about the number of participants. Is it something that is stable, or is it something that would change throughout the competition? That is one. And two, if you even like, if not maybe on a physical setting, if you plan to expand on the competition anyway, or any other online ideas that you would like to implement to make this a bigger competition or a bigger campaign.
Thank you, Amin. Nuria.
Thank you. So I wanted to ask, why did you decide to target mainly health students and instead of students in general? And I also wanted to ask if you're thinking of expanding the activity to maybe high school students as well, instead of only university students.
Thank you so much. You have 3 minutes. You can start now.
Thank you very much for the question. The first question was based on future plans. Well, we have a plan to recreate this activity in a hybrid way as in the past. And this month, in March, we are doing the next version of the La Batida with new participants, with a new modality, with the virtual and the physical modality, with new partners included. And that's our future plans. And also some of our future plans is like this activity has a great impact in its virtual modality, so we can recreate this activity more than in a national way, in an international way with other NMOs and with other regions too. The amount of participants, and if they at the end of the month they were accomplishing their goals, we have 80 participants. It is true that at the end of the month, many of the participants did not accomplish their goal, but more than the half accomplished it. The important thing here is that if we maintain their motivation with the policemen, and if we make the most interactive activity, they will enjoy the best. And finally, the target groups. Yes, we base this activity on medical students. However, some of our beneficiaries were the general population, and we can still recreating this activity for young people. For example, as you mentioned, general students of school grades. Thank you very much.
Thank you so much for your answers. Now we concluded our last activity. We're gonna move on to program promotion for 3 to 4 minutes and then the closing remarks. So stay tuned. Program team, the floor is yours.
Thank you so much, Hussam. It's so nice to see you again. So we're going to move on with our last break. For this, we have Mr. Mikołaj. He's going to tell us about some advice to have an activity enrollment not less than extraordinary. Nick, the floor is yours.
Thank you so much. Now I'm going to share my screen. Yeah. You've already heard how to enroll your activity, why it is important to do it, both for you and for IFMSA. But now I'm going to do a little introduction to how not to enroll your activity, because we as the program coordinators receive so many mistakes that must be corrected, because we can't simply, out of legal reasons and also out of the quality of the enrollment, we refer the enrollment back to the activity coordinator for some corrections. The most important parts, which provide so many mistakes, which makes so many enrollments invalid, is the candidature form. You wouldn't believe how many different mistakes there could be. First of all, when you enroll in your activity, please check whether the template is for the correct year, for the correct term, because so many of the activity coordinators, especially at the very beginning of the term, provide the templates for the previous year. So, for example, I received my first enrollment in my program that I received was for the with the year 2020-2021. Sadly, if that is the case, then I have to reject the activity and you have to submit it again. Also, the name must be in English, just like the form says. It's very important also to provide the correct name of your NMO. If there's a hyphen, please provide the hyphen. I know that it could be simply overlooked, but it's very important that it is correct. And also, it's very important to provide the correct and full name of the program that you would like to enroll your activity under. If you're unsure about some wording, you can always go back to the IFMSA website and check the exact name. Sorry, I need to get back to the former tab. All right. Another common mistake in the candidature form is the very end. There were cases where, obviously, on the right, then there needs to be a stamp and the signature of the NMO president or the NMO representative. I'll get to it in a moment. But the name in the middle must also be the one of the NMO president or the NMO representative. Many activity coordinators think that they should sign it at that exact point. What's important about the NMO representative is that in some NMOs, it's not exactly the NMO president. So the NMO representative per IFMSA bylaws is the person who's in the directory. So for example, there are NMOs where the association president is not acting as the NMO president. So you need to check exactly who that person is in your NMO. Another not so common mistake, but it happens, is that NMOs, the ACs provide the candidature form that they printed, filled in, with simply it's a handwritten form, and they signed it, scanned it, and sent it to the activity coordinator. Only the signature can be done in hand. Everything else must be typed and printed. So if your NMO does not cannot provide a stamp in the form of the PPNG file and also the signature digitally, then you can simply type everything in, print it for your NMO president, then they can sign it, scan it back. Like all of this information must be provided typed. They must be typed. Okay. So getting back to common mistakes. You can enroll your activity under maximum 2 programs. Sadly, in the activity enrollment form, some ACs provide, there's a question, what other programs would you like to enroll under? And they provide 3 or 4 or 5 programs. No, it's only allowed that an activity is enrolled under 2 programs. It is recommended also that every activity is enrolled under 1 program, but there is an option of the second one as well for special activities which need the support of 2 program coordinators due to the topics that those activities handle. Focus areas. In the website that I'm just about to return to, you can check all the available focus areas of every respective program. So let's turn to the program that I have the pleasure of leading this year. And here you are. These focus areas are the same that you can find in the program proposal, that every program has and can, of course, update after some time. If you feel that you don't really fit under any of those, you can simply contact the program coordinator of the program that seems most relevant to you, and we will try to resolve the issue. For example, there are activities in my database from previous terms which list biodiversity as its focus area, along with climate change. There are two examples, if I remember correctly. That information, if you feel that there is a blank spot in the program, it's a very important information to us, because we or our successors next year, in 2 years' time, we can adjust our program. We can alter the program proposal so that everybody, every activity, every important topic handled by IFMSA is included. So never hesitate to share your feedback. All right, now let's turn to goals and objectives. A common mistake is that those goals and the objectives and indicators, that the objectives and indicators are sometimes not linked, and sometimes they are written in a incorrect form. If you are unsure about it, if you are unsure whether the objectives and indicators that you wrote are consistent with what IFMSA would like to see in the database, you can always write to any of the PCs. It's important to learn, if you've attended AMOC or some other workshop, you may be familiar with the concept of SMART objectives. Just Google it, or better, find the relevant IFMSA toolkit for that, so that the objectives tell us everything that we need to know about where the activity is going and what the end game, what the end point of your activity is. Also, indicators must be linked with the objectives. Every objective must have at least one linked indicator, because the indicators serve so that we can know whether the objectives are being met or not, whether we have to adjust our activity design for the future. So it's of course there could be 2 or 3 indicators per one objective, but 1 is enough. If it's of course it may depend, but technically there must be at least 1. Methodology. In the methodology part, in the activity enrollment form, it's the place for you to shine. You please provide any information about all the interventions that you made in your activity to us. Provide the timeline, provide all the interventions, how many people were engaged, worked on the activity. Like, we want to know as much as possible, because then we will be able to provide that information to the liaison officers that really need that information, so that our federation can go forward, can cooperate with external partners. And only through that information, through information about your success, we can provide that success. We as program coordinators, programs team, and of course, primarily the liaison officers. All right. Also, yes.
Thank you so much, Nikolai.
Right?
Yes, we are running out of time, and the president sessions are about to start. So thank you so much for the amazing tips and tricks on enrolling programs, as well as filling up the CF. Now moving on to our closing remarks. Like, I cannot emphasize on how happy I am on behalf of the program team on hosting the first Rex Crossley Awards. It's amazing to see such an amazing activities and the uprising of the number of applications each year. as you know, our federation is built upon NMO efforts. So seeing NMO efforts rising each year, more amazing activity, more creative, innovative activities, proving the restless capability of a medical student, regardless of the COVID-19 pandemic, and how we adapted and we are returning to the physical activities. So I would like to congratulate you all. You are winners by making it to this 8th finalist list. So thank you so much for being here. And the final top 3 will be announced during March meeting. And last thing, well, before last, I would like to thank the program team for their efforts and support in making this Rex Crossley possible. And finally, I would like to thank the judges for making it here. I know you have president sessions. I know it's hectic for you, and you're gonna start the president session after 5 minutes. So thank you so much for the TO, for the IT, for being here and sharing your valuable inputs for these activities and sharing and evaluating these activities. And hopefully we're gonna have amazing winners and amazing events. So thank you so much all. And if you have anything to add, feel free, the mic is yours. If not, then have a great day.